Good evening and welcome to another one of our virtual Spirit of St. Agnes seminars, Find Your Fit. And when we say fit, we're not talking about the perfect outfit, but rather the most appropriate fitness plan to help you achieve and maintain good health. And who better to speak on this topic than our very own sports medicine expert, Dr. Richard Oravec. Dr. Oravec practices at our St. Agnes Care Orthopedic Institute as a lead physician at our Ortho On Demand, which he'll talk about later. And he specializes in non-surgical treatment of musculoskeletal injuries, fracture care, concussion management, and injury prevention. Dr. Orbeck has always led an active lifestyle himself, playing college baseball and competitive skiing, and he chose to become a physician because of his passion for exercise, nutrition, and injury prevention. And I can tell you firsthand, his patients love him. Here to speak with us tonight, Dr. Richard Orbeck.
Thank you for the introduction, and thank you for joining me on this Facebook Live event today. We're going to be talking about exercise and fitness. The coronavirus, the pandemic, the wildfires have really put a lot of limitations on our ability to exercise. A lot of parks are closed, the gyms have closed down for some time. A lot of these things are starting to open again, but we still have certain precautions and limitations put upon us. And we need to talk about what are some of the goals that we have in progressing during these times. Outdoor activities specifically are limited, and we're set up for poor nutrition with this pandemic. There's been supply chain failures. The availability of healthy foods is less, and processed and unhealthy foods is more prevalent. Along with home exercise equipment, there's a big shortage with just finding weights or exercise equipment so that you can exercise at home. The coronavirus isn't, and this pandemic probably will not be going away very quickly. So we need to evolve and take this in stride and use our fitness to help us be stronger during these times. Important notion is that 5% of our exercise capacity is lost in just 2 weeks, and that is multiplied after that. So it's very important that we remain active. The goals of today's talk are to talk about exercise training zones and what they mean for us and how we can apply them to our daily lives. What are the benefits of exercise, including with certain medical problems, and how do we prevent injury during exercise? I want to start off with an important point that I want everybody to go and talk to their family physicians before starting an exercise plan to make sure that you can do this safely. And you can talk to your family physician about an exercise prescription. There's no one cookie cutter model for all of this that pertains to everybody. Some of us have diabetes and we might need to adjust our medications if we start a new exercise plan. Some of us that may have had joint replacement, and certain exercises may actually be more harmful to us than other exercises. So I encourage you to reach out to your family doctors and talk to them about an exercise prescription. One thing that I think is an important point to live by is to create a culture and routine in our household that will promote physical activity. Examples of this is a daily family walk, vacuuming, push mowing the lawn, going for a bicycle ride with the family. During the coronavirus pandemic, a lot of these things may have been limited. So I noticed some of my patients, including family members, have been doing push-ups or sit-ups during TV commercials, and there's lots of ways that we can evolve and get creative and still maintain our activity. I'm going to talk to you a little bit about your training zones now. So training zones is where our heart rate specifically should be targeted for. So kind of the old school and older method that is not recommended is the heart rate, maximum heart rate equals 220 minus your age. The fatal flaws with this is it doesn't take into account our resting heart rate, our heart rate reserve, or our maximum heart rate. Somebody that might be on certain medications like a beta blocker might not be able to achieve a maximum heart rate, and that leads to this being an inaccurate calculation. That brings us to the Carbonian formula. I'm not going to go through the specifics of this. I left the formula there for you. It's something that you can talk to your primary care or sports physicians about, but that removes the bias of different resting heart rates, different medications, and it can give us a more accurate training zone. So what exactly are these training zones, and what are the intensities that I might be talking about in future slides here? So the definition of moderate intensity exercise is 50 to 60% of our maximum heart rate. The problem with this is you need a heart rate monitor to calculate these, and you need to calculate it individually for yourself based off of this Carbonian formula. So if we don't have a heart rate monitor, which I would encourage you to get, An example of a moderate intensity exercise is a brisk walk on ground level, cycling on ground level, push mowing your lawn. What is vigorous exercise? That is 70 to 85% of your maximum heart rate. Examples of this is jogging, running, cycling up a hill, or playing a sport such as basketball or soccer. How much exercise are we supposed to do? This is to maintain cardiovascular health. This might be daunting numbers, but this is something that we should all be striving for. And when we get to the benefits of exercise, you're going to understand why this is so important. Adults, it is recommended that you do 150 to 300 minutes of moderate intensity exercise or 75 to 150 minutes of vigorous exercise every single week. In addition to that, you're supposed to do 2 30-minute bouts of whole body resistance training. Examples of that are yoga, resistance bands, lifting weights. If that's not available to you, you can do some heavy gardening, so such as digging holes or planting things in the backyard. This might be daunting, right? So that's a lot of time to devote. Minimally, you're looking at 30 minutes, 5 days a week. One way that we can cut down this time frame is if you do high intensity interval training, where there's short intervals of vigorous exercise followed by short intervals of rest. So an example of this is 30 seconds, you go as fast as you can, and then you rest for 30 seconds, and then you do another 30 seconds, and you continually rotate this. The benefits of this, it cuts down your time frame by half. So that can help almost anybody fit this into their activities. So you can actually end up doing about 20 minutes, 4 days a week, in addition to the whole body training twice a week. Another common myth is that exercise leads to weight loss. That is not necessarily true. What leads to weight loss is a negative energy deficit or calorie balance. You need to get that into the negative. So diet and exercise with lifestyle changes can lead to weight loss. If you're looking for a recommendation on how much exercise is recommended to lose weight, it's 350 to 450 minutes per week. Another common another notion that I would like to stress is that the greatest benefits to your health are the shift from sedentary duty to modest exercise. Most of us have children. How much are children supposed to exercise? Children, it is recommended that 60 minutes of cardiovascular activity is done every single day, with 3 days of that being vigorous exercise. So the cardiovascular exercise activity is not technically defined, but is suggested that you do moderate intensity activity with 3 days being vigorous. So if they're playing ball with their friends or their siblings and they're playing organized sports, but children need to exercise every single day. And that's particularly important during the epidemic we have of childhood obesity in this country. What can we do to prevent injury? Number one, you want to get cleared by your primary care physician and make sure you're healthy enough to exercise and which exercises might be appropriate for you or safe for you. You want to start slow and go slow. So what I mean by that, specifically pertaining to the pandemic, a lot of us have taken some time off during the pandemic because of the restrictions, and whether that is a few days, a few weeks, or a few months, when we get back into exercise, you don't want to jump back into it immediately. You want to, a lot of times what my recommendation is to cut back by 75% and in intensity and frequency of the exercise and slowly add back 25% per week. Therefore, you can get to your goal within a month of getting back to where you were. You want to drink to thirst. So a lot of individuals or patients may drink schedule drinking. So every 5 minutes, you're going to take a sip of water or Gatorade or whatever drink it's going to be. That leads to significant, sometimes fatal electrolyte abnormalities, and that is not recommended. You want to drink when you're thirsty, otherwise don't schedule your drinks. You want to make sure you do an appropriate warm up and cool down. You got to make sure your equipment is fit properly and you go to the proper expiration of that equipment. Common example that I see is stress fractures in the foot on a patient exercising on shoes that have expired their lifespan. So shoes should be, a running shoe should not last more than 6 months or 300 miles, whichever comes first. And you want to cross train. So if you have a baseball player that plays baseball year round, they are more prone to shoulder injuries than if they are 3 sport athletes or 3 exercise athletes. So you want to try to not go to the gym and do the same exercises all the time. You want to mix it up. You want to play different sports, and that will decrease risk of overuse injuries and make you better at the sport that you want to participate your strongest in. What are the benefits of exercise? It can prevent and control diabetes. It decreases your blood pressure, systolic and diastolic, decreases your resting heart rate, increases your bone mineral density, specifically pertaining to the elderly population where fractures and hip fractures have a significant morbidity and mortality. In addition, it decreases fall prevention in the geriatric population. It makes you physically stronger. It reduces cardiovascular disease. It reduces cancer risk for many cancers, some of which are breast, bladder, colon, kidney, and lung cancers. And pertaining to the pandemic, there is evidence proving that regular exercise will increase your immune system and decrease upper respiratory tract infections. So it may have a preventative measure for the current pandemic. It helps you with weight management and improves your mental health. Specifically during these times when many of us are out of work and under a lot of stress, this is an avenue to help us reduce those risks. There's not many things in medicine that we can say that can make you live longer or prevent an early death. Exercise is one of them. DOMS, or better known as delayed onset muscle soreness. So those of us that get back into exercising might know or remember this time. So you go and you exercise in the gym and you're going to notice about 6 hours later, maybe 12, that muscle starts getting sore. If you're lifting legs 2 to 3 days later, you might not even be able to get out of the chair when you're at work. And then 5 to 7 days later, it starts getting better. So that's delayed onset muscle soreness. One of the myths that I commonly hear is that this is from lactic acid or lactic acidosis. That is not a true statement. It is a local inflammatory reaction. This is usually treated with anti-inflammatories, ice, massage, soft tissue mobilization, and passing the appropriate amount of time. How can we prevent this? What if I have a big marathon or a mountain that I'm training for that I want to climb, or I'm going skiing in Utah and it's going to be a 7-day trip and I want to ski for 5 days or 7 days and I don't want to be set back during that time? There's mixed evidence on tart cherry juice, It's suggested but not proven, so it may or may not work, but many athletes use this to prevent the muscle soreness. One thing that is proven is the repeat bout effect. So that is where you cause the soreness to happen, and then it will be inhibitory for about a month after that. So if you're going to go skiing in Utah, you might want to go about 2 weeks prior to your trip and lift heavy on the legs and actually make them sore. And then you'll go through that 1 week recovery phase, and then you'll be less likely to have that muscle soreness, and you'll be able to perform at your peak performance during your trip. Stretching. So speaking upon performance, static and dynamic stretching. So what is static stretching? That's when you take a muscle group or a joint and you hold it there. And dynamic stretch increases dynamics to that. Static stretching actually inhibits your performance, including speed, strength, and agility, whereas dynamic stretching does not have that inhibitory effect, which is why if you watch the Olympics, a lot of them are doing dynamic stretching. You don't see too many people taking their arm across and holding it before benching or powerlifting, because that has an inhibitory effect on that. This next slide has a kind of confusing statement I have there, but it's something that's important to know if we're training to be stronger and better at a certain activity. So I'm going to read it here and then explain it in a little bit easier term for you. So endurance exercise does not enhance your strength gains from resistance exercise, but resistance exercise does improve endurance exercise performance. So an example of this, a low resistance spinning bike will not enhance your strength gains, particularly when doing squats or lifting legs, but lifting legs will improve your performance when on a spin bike. In summary, from today's talk, so what are our exercise training zones? The training zones are specifically moderate and vigorous intensity exercises, I recommend that you get a heart rate monitor and use the Carbonian formula along with yourself or your primary care physician to calculate your training zones that are safe for you. I recommend that you get clearance by your primary care physician prior to starting an exercise program. I recommend that you try to follow your best in slowly working up to those exercise training goals over about a month, and 150 to 300 minutes of aerobic moderate intensity exercise per week with 2 30-minute bouts of resistance training. And if you want to decrease those parameters or time, you can do high intensity interval training. The benefits of exercise are immense, especially during this pandemic. With the coronavirus specifically, exercise has been shown to decrease upper respiratory tract infections, increase blood flow to the brain, make you more aware. It can improve your mental health. And I strongly recommend that you do this, but always take into account injury prevention. So make sure your equipment is fitted properly, you're exercising to the proper standards, you're going slow and working up to those injuries. And if there's any problems, you want to make sure that you go and talk to your primary care doctor or your local sports medicine physician. And that leads me to my next slide here, where we have our new walk-in clinic. If you have any questions, if you need advice, if you need an exercise prescription, if you need information on which medicines or how you should handle them during an exercise routine, or from broken bones or whatever you need, we're here to help you. Thank you, and I'm here to take any questions now. First question here, so I have a couple pieces of paper. So what, does it matter what time of day you exercise, AM or PM? I don't know if matter is the proper, it's more of what time is best for you or when are you best to exercise. So some individuals, it might give them trouble sleeping. Some individuals, it tires them out and helps them sleep better. Some individuals feel more invigorated when they exercise in the morning. For me personally, I exercise in the PM, but there's no evidence morning or night, which is best. Is there a better time of day to exercise? But I would encourage you, whatever time you can make that time is going to be the best time. For seniors, is outdoor biking good exercise for us is the next question. Outdoor biking is a great exercise specifically for overweight or patients with osteoarthritis and weight-bearing joints like the hips, knees, or ankles, because it's a low impact activity. You want to make sure you do it safe, you have good balance. Again, make sure you have a good exercise prescription from your family doctor to make sure you're managing if you have diabetes or your insulin. Make sure the bike is fitted properly. I see a lot of injuries from improperly fitted bikes, so it might be a good idea to get a static and dynamic fitting on the bike, which some of your local bike stores here in Fresno can do for you. But overall, I would say extremely good exercise. Next question. Is it safe to work through pain if you can tolerate it, or will it make it worse? Well, that's a tough question. If it's like the delayed onset muscle soreness and some muscle pain, and there's not maybe a direct injury or trauma to the area, maybe it is okay to exercise through it. But most of the time, if it's something that you don't think you can push through, or your strength is decreased and you can't protect yourself, then it's something that you're going to want to step back from, rest it, ice it, take some anti-inflammatories as long as they're okay with your other comorbid conditions, and give it a few days. Give it 2 or 3 days. If it's not getting better, then I would recommend that you go and see a medical professional. I have a question here about hip dysplasia. What kinds of exercises do you recommend? So hip dysplasia, a lot of times it depends on the degree of the dysplasia. So specifically, this is a good low impact exercises in general are going to be a good idea. So bicycle, elliptical, and swimming. You might have to do some sort of a custom fit for those activities though, because your range of motion is going to be limited in certain areas. This would be a good one for you to come into the office and be evaluated by a sports physician or one of our orthopedic doctors to see what the dysplasia and limitation is so that we can better recommend a safe activity for you. Next question is there such a thing as too much exercise? There is such a thing as too much exercise. So there's something called overtraining syndrome, You can overdo it. You can, and sometimes exercise goes along with, there's a fine line between some mental health disorders or eating disorders, such as bulimia and anorexia. If done right, there's likely not going to be a limit to your exercise, but your body does need time to recover. So if you're a baseball player and playing baseball and throwing and you're a pitcher and you're doing that every day or 5 days a week or 3 days a week and you're doing that year round, probably not going to be a good idea for you. You're going to want to cross train. If not, you're probably not going to be at your peak performance for that particular exercise. I hope that answers your question. The next question here. I work at a desk sitting 8 hours a day. How often should I be getting up to stretch? Well, I would encourage you, there's no evidence to this, this is just my personal opinion, but I would encourage you every 30 minutes to an hour to get up and take a deep breath and stretch. Patients with back pain may have to get up more frequently or even get a standing desk. Another thing to consider, there are treadmills or bicycles that now go underneath the desk so you can exercise while you're at work. That leads me to one other notion that I want to bring up that I didn't discuss in my slides, is that physically active individuals, so I have a lot of construction workers or patients that do heavy lifting during the day, that doesn't count for your daily requirement of exercise. Exercise is in addition to your normal daily routine. Even though you might be more physically fit than a person that has a desk job, if you're a construction worker or digging a hole all day, it's not counting towards your cardiovascular health. So you need to do 150 to 300 minutes of moderate intensity exercise in addition to your daily activities. I hope that answers your question, but I would say every 30 minutes to an hour is a good idea to get up and stretch and take a break, particularly for elderly individuals. Next question is, when I exercise my 150 to 300 minutes a week, can I divide it in 2 sessions daily to meet the weekly requirement? Absolutely, you can do your 300 minutes all at one time. Or you can do it in 2 days. That's just your weekly requirement. As long as you get that in, there's no limitations. You could do that in 3 days, 100 minutes a day. And this is for cardiovascular health, so that is correct. The next question, is biking good for someone who has back surgery? That's a good question. It's gonna depend on the type of back surgery, the fit of the bike, and what kind of bike. Most mountain bikes that have lower handlebars, probably gonna put a lot of stress on your low back. A recumbent bike or a sitting bike, you see a lot of those going around town. Those are a little safer for the back because you're not gonna be bent over all day. You're pretty much sitting in a chair. It's gonna depend what level, what the surgery was for, and what the other comorbid conditions or pathology is going on in the back. But biking is overall a good and safe exercise. If you're talking about also like a beach cruiser where the handlebars are a little higher, probably a little less stress on your back while you're exercising. Next question is, what is the minimum amount of exercise you can do and still reap the benefits? So that would be the 75 minutes a week of vigorous intensity exercise, which can be divided in half if you include that into high intensity intervals. Do we have any other questions? Well, I want to personally thank everybody. If there's any other questions, please feel free to reach out to us or come by the office and we'd be more than happy to do a consult and get you to your peak performance. Thank you for your time this evening and have a good evening.
Thank you, Dr. Oravec. Really appreciate you being with us. And thank you all for tuning in.